Well, as we mentioned earlier, a number of Palestinians dying of starvation is rising. Particularly vulnerable amongst them, of course, are children. Let's speak to our next guest, Ahmad AlHendawi. He's a regional director for MENA and Eastern Europe at Save the Children International. He joins us from Amman in Jordan. Good to have you with us. So, according to the Gaza Health Ministry, at least 88 children have died of hunger. Are we about to witness that number explode, get into the hundreds, maybe even the thousands, given that your report says 70,000 children under 5 are in acute malnutrition?
We are, and in fact, it's been reported, and as you highlighted in your shows and coverage, the situation in Gaza is nothing short of catastrophic for children who are being bombarded in their tents, imagine. And they have been really struggling with their basic necessities to access their basic rights. Children today is not only the numbers that are alluding to the number of children, the 88 that have died since the war started because of malnutrition. But Gaza today is at the brink of famine. And as it's been reported just last week, 2 of the 3 conditions of famine have been met in Gaza. And I think if it wasn't for the underreporting and the fact that it's very difficult to really capture the real numbers in the ground, perhaps the situation would be much worse. Definitely is much worse for children who are terrified that they might be killed at any moment. When the children we reach out to through our teams on the ground, they have been telling us they are not only terrified of dying, they are terrified as well that even if they survive, that they might not be found under the rebels. This is a catastrophic, apocalyptic reality for children in Gaza.
Is there still a chance to avoid that rapid escalation in child deaths, or have we passed the point of no return where saving some of them at least will prove impossible after this extended period of starvation?
Some will, but let me remind the viewers as well that starvation is not an event. It's not the absence of 1 or 2 meals. It's not about 1 or 2 days. This is about months, almost 4 months of this blockade, of a starvation that has built over a number of weeks and months. And to come back from that point of that extreme malnutrition and the point of starvation, it requires sustained supply of food and medical equipment, so also food supplements for children in need. It's possible to reverse some of that. I'm afraid some of this damage would be irreversible at this stage, but we can do more.
Ahmed, is that sustained supply that you're talking about, is that possible under this announcement, at least, of what Israel has announced of temporary daily pauses?
I'm afraid not. The needs for Gaza is clear. The needs is for no impediments in the face of a humanitarian aid to enter Gaza. We need that to be sustained at a scale. We're talking about close to 600 trucks needed on daily basis. We're not seeing that entering on a sustained way. And that's really the difficulty we're having as a humanitarian organizations, is about making sure that the aid enter Gaza, making sure that the distribution system that we have used before this last blockade almost 4 months ago is back on its feet and able to deliver aid for those in need. In that case, we will be able to really help. We do have the equipment, we do have the stock, we do have the ability to get the aid in, but we need the removal of any impediments for the humanitarian actors to enter into Gaza and help reverse this point.
So to be clear then, the food is there, you have the equipment. All that is missing is the political will on the side of the Israelis. This is a completely unavoidable, man-made crisis. This is not an unavoidable natural disaster sort of fallout situation.
100%. This is not a logistical issue. It's a political one. The needs and this requires a political solution in the first place. A definitive ceasefire is definitely needed. But in the absence of that, even making sure that the humanitarian aid is delivered in a safe and impartial way based on need, as we have been operating for months during this conflict. This militarized model, and allow me here to talk about the militarized model that was used over the past weeks of delivery of aid, is dehumanizing, undignified, unsafe, and completely un-humanitarian. We have seen massacres around these food distributions in Gaza, but close to 1,000 Palestinians were killed while seeking food, and thousands more have been injured. So going back to the very well-established mechanism for delivery of a humanitarian aid, and let me remind everyone that this protocols about how to deliver aid based on the humanitarian principles, they were not invented yesterday. The first Geneva Convention was in 1864 almost. That's almost 80 years even before the foundation of the United Nations. There are over 160 years of well-established practices for how to deliver aid during these conflicts. And what we're seeing today is the need for allowing aids to come in, allowing the humanitarian mechanism established by the United Nations with us, as Save the Children and other humanitarian agencies, to resume. And we need a definitive ceasefire on top of that so we can really deal with the tragic consequences of months of catastrophe for the children in Gaza.
All right, Ahmad AlHendawi, the Regional Director at Save the Children International, thank you so much for joining us.
Thank you.
Don't miss out and get the full picture. Subscribe to Al Jazeera for reliable news and expert insights. Like, share, stay ahead.